Hi there, my name is Tori. I am about 7 weeks post ACL surgery now on my right leg, and I'm so excited because my physical therapist has finally given me some more active stretches and exercises to start working on, which is great. I want to start this off by saying I am not a doctor, a physical therapist, or a surgeon, so make sure to talk to your healthcare professional before getting started on these exercises. This video is designed to help with post-knee surgery, anywhere from ACL, reconstruction, meniscus, or just to help strengthen your leg and work on pre-op preparation as well. So we're gonna get started off on my new bike, my favorite new tool that I got on Marketplace for 50 bucks. If you don't have one of these and you're looking, I would highly encourage checking on secondhand places because I don't know how long I'm gonna have this thing for, but for now it is great. So we're gonna start off doing this. I think I'm gonna do it for about 5 minutes right now. It's recommended anywhere around 10 minutes at a time, 3 times a day to just start building up the strength. For this video, we're just gonna do 5 minutes. If you wanna repeat that, you go ahead. All the bikes are different, but you've got different settings here you can check. And I up the intensity by twisting down here. So we'll go for about 5 minutes here. All right, I think that's good for now. So we'll get off our bike and move it out of the way. For today, we're only going to be needing our blocks. So if you've got yoga blocks, that's great. If not, you might be able to use even just a step for the main exercises we're going to be using these for. And I am going to pull in a little bench in a minute here as well. All right, so catch your breath. I'm going to be including a little flow in here as well. You might have seen from my other videos, I'm a yoga teacher. Today's not about yoga, but I just find it helpful to do some stretches as well. However, our first exercise is going to be coming away from the wall and just finding a place off the wall where you've got a nice 90-degree bend in your knees, knees over toes. This doesn't mean that your knee has to be in line with your heel, it just means you keep them in line. We're not going out or in, back up against the wall. And we're going to straighten it up and down. 8 more of these. And on the last one, we're gonna hold it down here for 30 seconds. Really starting to engage the quads, strengthen these. You can also start to bring in your core muscles here, engaging abdominals all the way from your rib cage down to your pelvic floor. This is my cat. She joins me in a lot of my videos, so you're always sure to see her on my vids. 10 more seconds. And up. All right. So it is helpful to have the wall close to you for these, just for a bit of balance and support. We're going to start off now by bringing the blocks stacked twice. And they're going to come underneath our knee because we're just going to be doing some basic lunges here. And this is just kind of a reference point of where we want to get to. So my surgical knee is my right leg. I'm going to start off with my left leg in front and my right knee ahead. Hands coming together at chest or using the wall for balance. We're going to do 10 here. And last one, up. All right, we'll swap legs now. It's important that both sides are done because we're strengthening different muscles on each side. Might need to move my blocks a little further out here, and I might be using my wall for support on this side, just because I've not quite got the strength and balance left and back in my right leg. So 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1, and up you come. While we've got our blocks here, we're going to do our heel lowers. So up to you whether you want to use 2 blocks or 1. I've actually been using my stair, which is kind of in between the length of these two. So I think for today I'm just going to do 1. And this is working on helping us gain strength to go up and down the stairs again. So the surgical leg comes on top of the block, flex the other leg, heel down, toe up. And we just do 10 little lifts here. 9, 8, 7, 6, 5, 4, 3, 2, and 1. My knee is making some creaking sounds there. Pretty sure it's okay. I checked with my physical therapist, but if you do hear any weird noises, creaks in your legs that you're not comfortable with, always get in touch with your doctor. The next thing we're going to need is to grab a little stool or bench. So I'm going to grab that now. All right. Here I am with my little stool. These are just going to be working on getting ourselves from sitting up to standing. Again, starting off with our knees in line with our toes, hands coming to our chest. You can cross them, whatever feels best for you. We'll do 10 of these. 1, 2, 3, 4. And on these, I notice I'm leaning to my non-surgical leg. So we really want to be focusing on including our surgical leg being balanced as we're pushing up, not leaning over to our non-surgical leg. Last one. Well done. All right, we'll move this out of the way for just a second now. Before we start the next round, we are just gonna do a little stretching. So grab a yoga block or two if you have them. We're gonna start off in a nice wide-legged standing position here, bending our knees, keeping our knees over our toes. We're gonna hold here for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Stand up slowly. Pivot your left foot away from you. Right leg foot towards the camera. Arms are going to come out wide, and we're going to come into triangle pose here. If you don't know triangle pose and don't do yoga, that is fine. We'll just use a block, keeping our left leg straight, hand underneath our left hand, right arm reaching up high, stretching out the inside of our left leg here, even on the outside of our back as well. 5, 4, 3, 2, 1, and come up to standing. Bring a nice deep bend into that left knee, maybe opening up your stance a little bit more. Coming into warrior 2 or a side lunge here. This is important to keep a lot of strength and activation in the surgical leg here if that's your right leg. This is going to be tough, and strengthening it is only going to help you out. You really need to engage the quad and hamstring and calves to keep support around that surgical knee. Here for 10 more seconds. 4, 3, 2, 1. All right, we're gonna pivot and face to the left. Left leg in front of us. Railroad track legs in line. Option to use the wall for support. Deep bend into the left knee. Arms raise up. Feel the opening in that right side of the hip and the strength in the left leg. Right toes lifted off the mat. Right heel. 5, 4, 3, 2, 1. And we open back up, coming straight into our deep squat once again. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Straighten the legs, toes slightly point in this time. Gonna hinge at the hips and come into a forward fold. Hands can come down onto the mat, or maybe using a block for a little bit of extra space here. Let your head hang heavy, open up the back of the legs. Five, 4, 3, 2, 1. Engage your glute muscles. Slowly come up to standing. Again, we're gonna come down, knees bent for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Rise. Left foot points towards the mirror, right leg out in front of you. Arms come out wide, and we're coming into triangle pose on this side. Option to use your block. Right hand on the block, left arm up high. Be here for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Come back up through center and bring a nice deep bend into your right knee. For me, this is my surgical knee. We need to be careful here, keeping the knee on top of the toe in line. Hands can be at your hip or extended long. We're gonna wait here, really starting to feel the strength in those quads building, opening up of our inner leg muscles. Here for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And we rotate away, left leg in front. Strong strength in that right leg, left leg extended high. Arms reach up or come here at chest center. Keep your left heel raised. See if you can bend an inch deeper into your right knee. 8, 7, 6, 5, 4, 3, 2, 1. Raise it up, rotate through center. Sink your legs down last time for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Raise up. And then we fold forward one last time here for about 20 seconds. Maybe you walk your hands over to one side and then the other, just to notice the differences in feelings, or finding stillness in the center is great as well. 8, 7, 6, 5, 4, 3, 2, 1. Engage your glutes, engage your core, and rise up through center. So that's one round here. Recommended to go through that whole rotation 3 times to get the full exercise, and ending probably with about 5 more minutes again on your bike to warm down the body. Follow along if you're interested in more yoga videos. I have a whole series on knee rehab and knee strengthening, and I'll be doing some other yoga strengthening videos, as well as just normal non-yoga activities to help work on strengthening back our knee. I'm right here along with you, so follow me on my journey to ACL recovery.